I want to thank you all for coming. The fact that you're here is really important to me and my family. It was about 5 years ago that my father was accidentally burned, and my mother took him to the nearest hospital. And he was admitted overnight to the hospital and not transferred to a burn center until the next morning. Once my mother and father were at the burn center, the physician at the burn center let them know that he should have been transferred much sooner. He should not have been kept overnight at that rural hospital. And my father died about 12 days after that transfer. And at the time, I was a PhD student at the University of Washington studying biomedical and health informatics. And I had learned about medical errors in one of my classes, but of course I was learning from the side of the care providers. And I can tell you medical errors was a topic I did not like. It was just icky to think about, and I was glad when the topic was over because I was sure I was never going to encounter it again. And then 2 years later, I was now encountering this with my own family. And so it was deeply important to me and my family to understand why wasn't my father transferred immediately to the burn center? Why was he kept overnight at that rural hospital? And it took us a very, very long journey to begin to learn why. And so that's what I'm going to share with you tonight. And I'm going to be building a timeline as I go through my presentation. So these are the events that started off our journey in 2012. Having learned about medical errors in a classroom environment, I knew it was really important that the hospital acknowledged what happened and that they understood what happened so that this type of thing didn't happen to patients in the future. I was also in a situation I could get some advice. So I reached out to some faculty members who were physicians and I said, here's what happened. Who do I reach out to? I don't know. Where do we start? And the recommendation was set up a meeting with the CEO of that rural hospital. So I wrote a letter and we had a meeting in June. This meeting was strange and it was frustrating. So we needed to express our concerns to the CEO about what my mother had seen that night in that hospital. We needed to have him acknowledge what we had gone through. The CEO started out by offering condolences on my father's death. And then as we got into the purpose of why we were meeting with him, and my mother was talking and I was talking about our concerns, we felt our concerns were just simply waved off. I remember at one point literally waved off when my mother was explaining the frustration of the nurse that night, and the CEO actually just took his hand and went like this. And it was very, very deeply disturbing to see that response to our concerns that were just waved off. And the conversation itself was also very strange. At no point did the CEO actually make statements as to the effect that would acknowledge my father had been in his hospital. That's what we needed to talk about, and yet he could not have a conversation with us about that. And he told us that he is prohibited from talking to my family about my father's care due to state laws. And he made it clear that he just can't talk to us because of state laws. So we left, my mother and I left that meeting, and we weren't going to stop there. We needed to keep pushing on this. So we decided we would write a letter to the CEO. After all, maybe he was just totally unprepared for the meeting, and I wanted to give him a second chance to respond to our concerns. So I'm going to share with you the 4 topics of that letter and the responses. So we asked the CEO to address teamwork training in his hospital. Based on my mother's description of what happened that night, there was just no teamwork training. And based on the research I had done at this point, I was a PhD student, I'm used to doing research, and I was doing a lot of research, and teamwork training is a big deal in hospitals. And we asked that they get some teamwork training. The response in the letter, we did get a response about a month and a half later. The response to that, we've focused on teamwork and continuous improvement of care, and to say that they actually engaged Kansas Foundation for Medical Care to provide the Team Steps training session back the previous year. Okay, well, he also added, we have endeavored to create a patient advocacy policy, and a number of our staff members actively took advocacy efforts until his, well, so what were we supposed to respond to this? We wanted them to have teamwork training, and they've claimed they've already done it, so I guess that box has been checked off. And then to say that you have a patient advocacy policy, well, it seems a little empty to us, but what were we supposed to do or say or respond at that point? So that was one issue. Another issue was payment for services. We needed to bring up the question of, wait a minute, are you going to be billing? Here's the response. We've placed a hold on patient statements being sent on the account at this time. And in the normal course of business, we have processed claims to payees before we received your letter on July 1st, and the account has been paid in full. So when I first read that, I thought, okay. And then I realized, I don't understand what this means. And then I felt really uncomfortable with it, because this hospital had not provided good care, but Medicare and my parents' insurance was being billed for this, and that just didn't sit well with me. The next topic, education of the ER physician. Now, this is a rural hospital, and so it was not a full-time ER person, but it was someone who covered the emergency department, and we needed to bring up that this uncomfortable topic, that maybe the ER physician needs some more education or training. When I went back to Seattle, I wanted to look up transfer guidelines for sending patients to a burn center. I looked online and I found it in less than 2 minutes, and I have no medical education. So wait a minute, why didn't this physician know about those guidelines? So the response to that was, the physician has worked shifts in that department regularly, and our emergency department is frequently complimented by patients for our care. I need you to know, this is not the right thing to say to patients and families. We're talking about our experience, my father. I don't care if every other patient has had an outstanding experience. That is not relevant to us. Also in the letter it said, hospital care continues to be physician order dependent, and the ultimate decisions are made by physicians. So immediately I thought, wow, this is not at all patient-centered. But then I thought, I wonder if that's in there for another reason. The physician was not an employee of the hospital, but was on contract, as is very typical. And it kind of sounds like the hospital is saying, it's not our problem, it's all that physician's problem. That is also not something that should have been said in this situation. Because see, my mother and father, they went to the hospital. We hold the hospital accountable for his care. By trying to put it on this physician, that does not sound right. The next issue, this is a little weird, but the CEO made it clear he was not going to tell us about my father's care. We had a need to know. The hospital had looked into this. The hospital understood it. The hospital was taking it seriously. How could I possibly get that confirmation if he's not willing to talk to us? Well, I realized they probably should have reported this to the state as an incident. So if he was willing to tell me, we have reported that, as weird as that sounds, that would have helped out my family. And you can imagine how that went. Here's the response that they can't tell us that, and they can't tell us that. So after getting that letter back, again, that was not satisfactory, and what can my family do next? Well, we can write another letter. So my mother wrote a rather lengthy letter, and I'm going to share a few points from that with you. Oh, wait, I've got another one. Oh, yeah, so the organization and our board of trustees take seriously the duties of oversight and governance. That's also something you should not say, and here's why. This is just saying, just trust us, everything's fine. But see, my mother and father trusted the hospital when they walked into the emergency department at the end of March. The trust is gone, and the hospital needs to earn it back. So saying just trust us, it's the wrong thing to say. Okay, so back to my mother's reply. It was very important for her to point out where were the results of the advocacy efforts. The CEO claimed we had advocacy efforts, our nurses had advocacy for your father that night. Those are just words. What about the actual actions? There seem to be no results to that, so why are you talking about this? Also, my mother said, to have our questions not answered as to why Glenn did not receive immediately transfer makes us feel that you are hiding behind a couple of statutes. Disclosure to patients and their families is neither prohibited nor required. And it was just endlessly frustrating to have a CEO take a position, the state prohibits me from talking to you, and that's it. We know that's not true. We've looked at the statutes, we can read them, that's not what it says. It says that the internal documents of investigations, no group can require that they be disclosed. Those can stay private and internal. It doesn't say that you can't talk to patients and families about what happened. That's not what it says. And one more point of my mother said, since your letter of August 22, we have considered a number of options, one of which is a lawsuit. So a lawsuit was one option, but we gave the hospital a couple other options. One possible option was to develop and implement a disclosure policy. So my family had a terrible experience with not receiving disclosure, but for later patients, we wanted them to have disclosure. So if this hospital was willing to develop and implement a disclosure policy, we would have felt like we had an impact. And at this point, I had done enormous amounts of research, and I sent them lots of references to help them along. Another option that we presented was to write a statement to the community, letting them know that in this hospital, we do not disclose errors. We don't talk to you. If you can't be honest with people when bad things happen, be honest up front. You're not going to be honest later. I mean, there needs to be honesty someplace. So that's, and the third option was to come up with another option, because we really wanted to work with this hospital. We began to realize this problem was much deeper than we realized. I really thought we would have 1 or 2 meetings with the CEO, we would get information, we would be able to put this behind us and go on grieving my father's death. At this point, we were realizing there's 2 possibilities for why they're not talking to us, because I don't buy the thing that the state law prohibits you from talking to us. There are 2 possibilities. And the first one is, we will not talk to you about Glenn's care because we don't have the information, because we didn't investigate, because whatever may or may have happened is simply not important. That could be a reason they're not talking to us. It's just not important enough. And there's another possibility. They won't talk to us because we don't want you to know what happened, because we don't want to admit that we really screwed up, and we screwed up worse than you think. And those are the 2 possibilities of why they won't talk to us. They either know or they don't know. About a month and a half after my mother's letter, She did get a meeting with the CEO and the hospital lawyer and a board member. And the result of that meeting was they still insisted they could not talk to us about my father's medical care. So, at this point, we realized we needed to go outside the hospital for accountability. So, my mother filed complaints with the State Board of Healing Arts in October about the physician, and with the Kansas Foundation for Medical Care. This is a group that investigates complaints on behalf of Medicare patients. We filed those complaints, and we did receive responses from each of those. The State Board of Healing Arts could tell us nothing. We do believe from what they said they did conduct an investigation, but they cannot reveal any outcomes to patients and families. Now consider this, the people most affected by this is my family, and we're not allowed to have this information about what they found. It's the other people who can have this information, not my family. The Kansas Foundation for Medical Care, they came back they said, we determined that some of the care that your husband received did not meet professionally recognized standards of care. So that was not at all a surprise, but it was at least, it was something. It was something. It was not a surprise, but it was something. At this point, I wrote to the CEO in an email, and I told him that Kansas has a statute of limitations on filing lawsuits, and it's going to be up in a couple months, and our family has some decisions to make. I received no reply to that email. And so a decision to file a lawsuit was made. We did everything we could to avoid this, and this is the point we made the decision to do this. Now, my family was able to find a lawyer, and so as horrible as our situation was, my family was fortunate. So many patients and families can't move past this step because, see, so legally a lawsuit needs three things. There needs to be harm, there needs to be negligence, and the negligence caused by the harm, legally. But as a practical matter, there's something else that's very, very important. The case has to be financially viable. So lawyers don't take cases as charity, it's a business. They need to turn a profit. Medical malpractice suits are very involved, very expensive. They have to look at what a family presents and make a quick determination. Is this a good case for me to take? Am I likely to win? And if I do, is it going to pay out enough that the lawyer can be paid and the family still gets something? We were fortunate to find a lawyer, I believe without hesitation, and I want to tell you, at this point, we experienced great customer service at this point. The law firm was very responsive to questions, our needs. It was great customer service. So the lawsuit was filed. Depositions are, I had no idea what a deposition was, but I found out. So the depositions for this case, my mother, myself, and my brother Anthony needed to testify. 2 friends of our family that came to the hospital that night were called to testify. 4 nurses, 1 physician assistant, 3 physicians had to be named in the suit because, see, once a lawsuit is filed, physicians can't be added, so they didn't know what they were going to find, so they needed to name 3. Hospital administrator and 5 expert witnesses is what it took to get through depositions. I have a graph here. of the pages of testimony for these depositions. So these were pretty much full-day depositions, and these were half-day depositions. But my point is not this. My point is this. My brother's was 3.5 hours. Mine was 8 hours. My mother's was 8 hours. Keep in mind, my brother was in Los Angeles at the point my father was in that rural hospital. I was in Seattle at the point my father was in that rural hospital. And I really want you to get a sense of what a deposition is like. My mother's covered topics from how their education, how she and my father met, to their finances in ridiculous, gory details. There was I feel, a complete invasion of privacy. The phone calls made, they requested my family's phone records. My mother's questioning established that she did not take the initiative to ask for a transfer, and it established that no one told her that she could not ask for a transfer. My brother's questioning included, he was asked whether my mother has ever said she feels guilty about anything she did or did not do while my father was in that rural hospital. And as far as mine, I'm going to read you some of the discourse I had with a defense lawyer. And keep in mind, there were 4 defense lawyers, 1 for each physician and the hospital, as well as the insurance company representative in this room. So the context of this questioning is my mother's description of the nurse's attempts to have my father transferred, because my mother witnessed that nurse trying to get my father transferred that night, and it just didn't happen. And so the defense lawyer says, you understand there's a difference between someone saying he may need to be transferred versus he likely will be transferred. Just answer that question. Do you agree that there's a difference between those statements? My response, yes. The lawyer, and it's your testimony that your mother has told you the emergency room nurses, that it was likely he would be transferred, correct? Yes. Lawyer, not simply may be transferred, correct? And me. What my mother conveyed to me is that he was likely to be transferred. Lawyer, you understand there's a difference between saying he likely will be transferred versus saying, I think he needs to be transferred. Would you acknowledge there's a difference in those statements? Me. I acknowledge that. I was not there at the conversation. I do not recall exactly what my mother said. And here's some more. And the context of this questioning is whether my mother wanted him to be transferred. So the defense lawyer says, do you know if your mother expressly made any request to transfer your dad prior to the morning of the 31st when the transfer compliance form was signed? I say, my mother spent the night in the ICU watching the ICU nurse attempt to doing everything she could to get him transferred. So her reasoning was, if the nurse cannot get him transferred, what could I possibly do? The lawyer, okay, let's have the court reporter read the question again. It was repeated. Me, sir, whether she specifically made a statement using the word transfer during that night in the ICU, I do not know because I was not there. Lawyer, okay, and I appreciate your point. You've made that point several times in the deposition, and I understand that, okay? What I'm trying to understand is whether or not your mom told you she had requested a transfer. Me. My mother did not make that statement because she was not aware she could request a transfer. Lawyer. Okay, is she aware of that now? On and on and on. And on and on and on. Another part of it, and this was whether, so the lawyers were aware that my family wanted the communication issues in the hospital being addressed. And so they also questioned us about that. So the defense lawyer, Are you aware of any communication concerns at a rural hospital since this hospitalization? Me. I'm not a part of the medical staff, so no, I would have no knowledge of this. Lawyer. So your desire is that something like this doesn't happen again in the future, right? Me. Correct. Lawyer. But you don't have any evidence that is going to happen in the future, or has it, or it has. Me. Okay, no, I don't have evidence I could point to that would show that. Lawyer. Do you know if there have been any changes in policy at the rural hospital since this? Me. No, I know of no policy changes. Lawyer. You don't know whether they've occurred or not occurred? Me. I have no knowledge of any policy changes that have or have not occurred at this medical center since my father's incident. Defense lawyer. The same for training? Me. I have no knowledge that anything has happened. Defense lawyer. So you don't have any knowledge. You don't have any knowledge of whether the filing of this lawsuit will make any difference in the future. My response to that was, you're asking me for evidence from the future? And so this line of just repetitive and nonsensical questioning is this. I want you to understand what families go through in depositions. What happens when healthcare workers don't provide the information and families end up going through this. A couple months after that very long string of depositions, so my families went first in our depositions and our friends of family, and then it was the physicians, the nurses, the expert witnesses, and on and on. And my mother was able to attend those and sat through that and learned a great deal. At the end of the depositions, all I can tell you about what happened is to use the phrase, "the matter has been resolved." That's all I can tell you. That seems like a very odd thing to say because has been resolved. Well, at no point did any no one with medical training sat down and explained to my family what happened at all. So it feels quite unresolved to me. We have learned a great deal about what happened to my father that night, but that's from piecing together information from the depositions. That's the summary of what my family went through to learn what happened. And so I want to tell you what should have happened. That's what did happen. Let me tell you what should have happened. So once my father was at the burn center, they notified that rural hospital that he should have been transferred immediately. At that point, the rural hospital should have reached out to my family and said, we've just learned from the burn center, he should have been transferred. They feel he should have been transferred sooner. We're going to investigate. We're going to get back to you. If you have any questions or concerns, let us know. Then that rural hospital would do their investigation, and whether it was a week or 2 weeks or 3 weeks, I mean, I don't know. But within a reasonable amount of time, get back to my family and said, here's what we learned. Here's why this happened, and here's the steps we're going to take such that these type of miscommunications, this type of lack of good decision making doesn't happen again. And they also likely should have done some proactive financial compensation because they harmed my father. And instead of providing adequate care, they caused harm. And so had they done that, it would have let us know, first of all, that they realized that they screwed up. It would have communicated to us that they were taking it seriously, that they were taking the responsibility seriously, that they had made changes, and that they also had a level of integrity. And that had the hospital done that, none of this would have happened. So I'm going to have my mother come up now, and she's going to share with you some of what we learned that happened that night.
5 years ago, the 30th of this month, my husband, Glenn, who you see here, was helping with a controlled burn on a dam. He'd done this several times before, but this particular time, something went terribly wrong. He could not escape from the flames, so he dropped into a shallow stream that was created by the overflow pipe. His clothing did not catch on fire, but the left side of his face and his back were mostly what was burned. I drove Glenn to the nearest emergency room, which was in a rural hospital. It was early evening at that time, and Glenn was diagnosed with 30% total body surface area, second-degree burns. There was no evidence of smoke inhalation, but he was given medication for pain and nausea, and IV fluids were given to him. And he was put in the intensive care unit of that hospital, where I spent the night with him. The ER doctor told me that he did not feel that Glenn's burns were bad enough to need to go to the burn center. That was where I made the biggest mistake of my life, because I trusted that doctor in that hospital to give Glenn the very best of care. That hospital's protocol called for Glenn to be intubated, to be given lactated ringer, intravenous fluid, following the Parkland burn formula, and for transfer to a burn center. But here's what really happened. Instead of following the Parkland burn formula recommendations, Glenn was given normal saline with 5% dextrose instead of the lactated ringers. In the first 8 hours, instead of giving him at a steady rate half of what he should receive within the first 24 hours, he was given a bolus of 3,000 milliliters of the dextrose 5 normal saline while he was in the emergency room, which was about an hour and a half. Once that was administered, the fluid was reduced to 70 milliliters an hour. The problem with this, besides the dextrose raising his blood sugar to extreme levels, was that the bolus quickly increased pressure in the vascular system and forced fluid out of the leaky capillaries. It also did not allow for proper urine output and contributed to kidney failure. In ICU, it was not long before Glenn went into hypovolemic burn shock. Instead of being given additional fluids volume when his blood pressure dropped, he was administered vasoactive medications to artificially elevate his blood pressure. Blood flow was decreased to his kidneys, which increased his risk for renal failure and cardiac arrest. Pressors also decrease blood flow to second-degree burns and cause them to convert to third-degree. Not long after being admitted to the ICU, the nurse was so concerned that she called the doctor on call. And this was after she had already talked to the burn center, requesting advice from them. Without taking a look at Glenn or visiting with the ER doctor, the on-call doctor increased the IV fluid to 150 milliliters an hour, increased the IV Demerol, which was started in the emergency room, and ordered Solumedrol, a steroid. The hospital protocol specifically states steroids are not indicated in the treatment of burn wounds. Also, no creams, ointments, or wet gel dressings. Both doctors had ordered creams for the burns. About 12:30 a.m., Glenn's monitor strip showed that he went into a complete heart block, during which he had a 4-second pulse without an effective heartbeat. No one noticed. About 1:30 a.m., the ER doctor made a quick visit to Glenn, but this was only after the house supervisor once again tried to get him to order transfer. The doctor wanted to wait and see how he was in the morning. Instead, he ordered Lasix, a diuretic, with the idea that it would stimulate his kidneys. It didn't. He also ordered dopamine to raise his blood pressure. A side effect of dopamine is an increased heart rate. And after about 25 minutes, Glenn developed tachycardia, thus decreasing his blood pressure. Without doctor's orders and out of desperation, the ICU nurse increased the dopamine rate several times during the night. Glenn was given more than the maximum allowable dose. At 2:25 a.m., a bolus dose of morphine was given for pain. Also, a morphine PCA pump was started to allow Glenn to administer his own pain medication. Glenn had been unresponsive for quite some time. I doubt that he was even aware of it. Around the 7 o'clock a.m. shift change, the intensive care unit nurse requested the physician assistant, who would be covering the emergency room, to come see Glenn. He immediately ordered intubation, lactated ringers at the appropriate rate to replace the dextrose 5-normal saline, proper medication, and arranged for transfer. He also told me he expected Glenn to die. Transfer by ambulance took place at 9:42 a.m. and they arrived at the St. Francis Burn Unit at 10:45. During my first visit with the burn doctor, he told me he expected Glenn to die before the day was out. Glenn proved him wrong. Part of Glenn's treatment at the burn center was the use of insulin to reduce the blood sugar, and 1 dialysis treatment, after which his kidneys started functioning. But in other respects, the damage was already done. Glenn was scheduled for skin graft surgery on his entire back on April 6. This had to be postponed because he became unstable during the night before surgery. Surgery did take place on the 9th, but on the afternoon of the 10th, all the progress he had made was gone. On the morning of the 11th, I was told I need to consider removing him from life supports. That was the hardest decision of my life. He died within 5 minutes. Using hindsight, after everything I have since learned, I wish I had raised hell when that doctor put Glenn into the intensive care. But I knew little then about severe burns. I realize now that I was traumatized, and I did not ask questions or even know what to ask. The ER doctor never really told me anything, even his name. Very few words were exchanged between us. And it took a lawsuit for me to learn of the lack of teamwork and the lack of following protocol at that hospital I took Glenn to. I now know that the ER doctor disregarded the urgings of the nursing staff to transfer Glenn. I learned that the doctor on call was contacted, but chose not to make the 5-minute drive to the hospital. I also learned that the administrator on duty that night, who happened to be the chief nursing officer, refused to call the emergency room doctor. She said she did not see what good would come from it, and she was leaving it up to the practitioners. When I learned all this, I found it both unbelievable and disturbing. I now know what happened, but the one question I never really got answered was why? Why did Glenn not get transferred sooner? I can speculate, but I would really like to know the true reasons. Early on, I decided I was not going to let Glenn's death be in vain. This event that is taking place is because of what happened to my husband, my children, and myself. Not all medical errors look like what we went through, but all medical errors need to be treated with respectfully, honestly, and fairly. And I am asking all of you to set the example to bring about the cultural medical change that needs to take place here in Kansas, so that communication and resolution are the norm, not deny and defend. But please make no mistake, it will take a cultural change. Thank you.